Assalamu alaikum. Today I would like to discuss about lung cancer. We know that lung cancer is the most common cause of death in anywhere in the world. This is the chest X-ray of a lung cancer. In here you can see the pneumonic coin lesion on chest X-ray. This is a pathognomonic sign of lung cancer. If you find a case who may be smoker or may not be smoker, he is aged person, and you see a person who has this kind of cough hemoptysis, chest pain, and if you do chest X-ray, if you see this kind of lesion, this pneumonic coin lesion, you can guess that this person might have lung cancer. Chest X-ray is not confirmatory. For other confirmation, you should do this. This is a picture of CT scan. In here you can see that non-contrast. You can see that nodular nodule-like lesion, but it is non-calcified. Non-calcified nodular lesion is seen on CT scan. This is another picture of the CT scan where you can see non-calcified nodule. Okay, first thing you have to remember that if you think about lung cancer, it may be primary, it may be secondary. If it is primary tumor, then the site of metastasis from lung, it is liver, adrenals, bones, brains. Liver, adrenal, bones and brains. Liver, adrenal, bones and brains. Liver, adrenal, bones and brains. And if it is secondary, that means cancer in somewhere in the body, but it comes into the lung. It is more common. Secondary one is more common, like bladder cancer, like colon cancer, like female breast cancer, and there may be prostate cancer. If in female there is breast, there is a prostate for male. So if the cancer is secondary, that means cancer in somewhere in the body, like in bladder, in breast, and in colon or in prostate, and it metastasizes to the lung. The primary common area are bladder, breast, colon and prostate. If you divide the lung cancer, you can divide into two parts, that small cell lung cancer and non-small cell lung cancer. And non-small cell lung cancer can be further divided into labs, that means large cell lung cancer, adenocarcinoma, squamous cell carcinoma, and bronchial carcinoid tumor. Sorry for my writing, but it happens. Large cell carcinoma, adenocarcinoma, bronchial carcinoid tumor, and squamous cell carcinoma. So you have to, for starting, if you want to start the reading of lung cancer, you have to go through first this, then you should jump on the other type of lung cancer, like small cell, non-small cell. In this video I will show part by part, step by step, all the lung cancer and its complications. Now start with small cell lung cancer. This is the picture of a small cell lung cancer, and in arrow you can see the you can see the dark blue cell. You can see the dark blue cell. This is the dark blue cell. There is another dark blue cell. What it indicates? It indicates the it indicates that it is the neuroplasm of the neuroendocrine cells of the Kalchiski. It is the neuroendocrine tumor, and it is derived from neuroendocrine cells of Kalchiski. And as it is neuroendocrine tumor, there are some markers which is positive in neuroendocrine tumor, like chromogranin, like neuron specific enolase, like synaptophysin. It is positive in all neuroendocrine tumor. As it is small cell lung cancer usually located centrally. This is high yield. Can you tell me other lung cancer which is located centrally? The other starts with the S, that means squamous cell lung cancer is located centrally. Okay, as it is lung cancer, you can easily say that it will produce some paraneoplastic syndrome, and all the paraneoplastic syndrome can be remembered by the word A. That means it may produce ACTH. That means it produces Cushing syndrome. There is antibody against the presynaptic calcium channel. If there is antibody present in presynaptic calcium channel, can you tell me the cause where there is presence of antibody in presynaptic calcium channel? It is actually Lambert-Eaton or Eaton-Lambert syndrome. In Lambert-Eaton syndrome, there is presence of antibody against the presynaptic calcium channel. If there is presence of antibody in postsynaptic acetylcholine receptor, can you tell me the disease where there is presence of antibody in postsynaptic acetylcholine receptor? This is myasthenia gravis, but myasthenia gravis doesn't happen in here. In paraneoplastic syndrome of the small cell lung cancer. And another paraneoplastic syndrome is another paraneoplastic syndrome. You have to remember that it may cause myelitis, it may cause encephalitis, it may cause subacute combined degeneration, and another A is amplification of MEK oncogene. There is amplification of MEK oncogene, and it is undifferentiated and highly aggressive. It is associated with smoking, and for treatment of the small cell lung cancer, you should give chemotherapy with or without radiation. Now start with large cell cancer. Can you remember I have said unknowingly that in non-small cell lung cancer, all the non-small cell lung cancer can be remembered by these LABS labs, that means large cell carcinoma, adenocarcinoma, bronchial carcinoma, tumor, and squamous cell carcinoma. This is the picture of large cell carcinoma. This is the pleomorphic giant cell. This is the pleomorphic giant cell, and in large cell carcinoma you will get this pleomorphic giant cell. This is the histology of large cell carcinoma, and in large cell carcinoma everything becomes poor. That means it has poor prognosis. It is poorly differentiated. That means undifferentiated. Poorly differentiated, that means undifferentiated. And usually we resect the cancer surgically. In this case we actually resect the cancer surgically, and it is located peripherally, not centrally like small and squamous cell carcinoma, and it is highly strongly associated with smoking. This cancer is strongly associated with smoking. Large cell cancer strongly associated with smoking. And in here there are some features that breast becomes enlarged, and it will cause gynecomastia, and there is secretion of milk. That means in here you may get gynecomastia and galacturia. This is very important. If you see a lung cancer where there is gynecomastia and galacturia, you can easily sense that this person might have large cell cancer. This person might have large cell cancer. Now, adenocarcinoma. This is the histology of adenocarcinoma. In here you can see the glandular pattern on histology. This is the glandular pattern. This is the glandular pattern on histology if a person having adenocarcinoma. This is the most common primary lung cancer. It is the most common primary lung cancer, not associated with what? Not associated with smoking. It is high yield that this is the only cancer that it is not associated with smoking, and rest of the lung cancer is associated with smoking, and it is mostly happens in women. This is the chest X-ray. It looks like a consolidation and hazy infiltrate. This is a hazy infiltrate. You might be in a fix that the patient might have pneumonia. That's why chest X-ray is not confirmatory for diagnosing all lung cancer. You have to do biopsy for confirmation of the lung cancer. You have to do CT scan. Okay, this bronchoalveolar type of lung cancer in here, bronchoalveolar type of lung cancer in here, you may see the hazy infiltrate, looks like pneumonia, but this is adenocarcinoma. In adenocarcinoma, the associated mutation, you have to remember that associated mutation is, can you tell me the associated mutation? It is KRAS, it is EGFR, this is KRAS, there is EGFR, KRAS, EGFR and ALK. Associated mutation is KRAS, EGFR and ALK. This cancer, this adenocarcinoma, usually happens peripherally, not centrally like other small and squamous cell carcinoma. It is present peripherally. The location is peripheral, and there is presence of hypertrophic osteoarthropathy. There is hypertrophic osteoarthropathy, and In bronchoalveolar subtype, there are some words. In bronchoalveolar subtypes, it grows along the alveolar septa and there is apparent thickening. There is apparent thickening of alveolar wall. Apparent thickening of alveolar wall. There is tall columnar cell containing mucus. There is tall columnar cell containing mucus. And so adenocarcinoma, the most important thing in adenocarcinoma, what you have to remember, the mutations. You have to remember the mutations of adenocarcinoma, that is KRAS, EGFR and ALK, and it is not related to smoking. It is not related to smoking, and it usually happens in women. Most common lung cancer in women. Now, squamous cell lung cancer. This is the picture of squamous cell lung cancer. This is the histology of squamous cell lung cancer. In here you can see the keratin pulse with intracellular bridges, keratin pearls and intracellular bridges. This is the most important word you have to remember for squamous cell lung cancer. It is, as it is squamous, so it is centrally, and it is associated with what? Smoking. And in this X-ray you can easily interpret that this is the hilar mass. This is the hilar mass arising from the bronchus. Hilar mass arising from the bronchus. Hilar mass arising from the bronchus. On chest X-ray, there is hilar mass arising from bronchus. There is hilar mass arising from bronchus. And other thing you can easily remember by this 3C. That means in here there is cavitation, there is calcemia, that means hypercalcemia. There is cavitation, there is hypercalcemia, and there is cigarette smoking is related. Calcification, hypercalcemia, and cigarette smoking. The association is cigarette smoking. Hypercalcemia. Why hypercalcemia? There is parathyroid hormone, PTH, parathyroid hormone related peptide is associated. That's why there is sorry, that's why there is hypercalcemia. That's why there is hypercalcemia. Now, last one is a carcinoid tumor of the lung, that means bronchial carcinoid tumor. In carcinoid tumor, the features are wheezing, flushing, diarrhea. In another video, I have discussed about the carcinoid syndrome, but in here there is carcinoid tumor of the lung, that is wheezing, flushing and diarrhea. This is the feature. This is the nest of the neuroendocrine cell. This is the nest of neuroendocrine cell. This is the nest of neuroendocrine cell, and in here there is chromoganin A is positive. Where there is neuroendocrine cell, I have already told you that there is chromoganin A is positive. All the neuroendocrine tumor, there is chromoganin A positive. This is the endoscopic view where there is mass lesion in the carcinoid tumor. In carcinoid tumor, it has excellent prognosis. And it is located both centrally and peripherally. It is located both centrally and peripherally. Now, now I would like to discuss all the complications of the lung cancer. Starts with now. This is the complication of the lung cancer. First of all, this is superior vena cava syndrome. In superior vena, this is the first complication in lung cancer, superior vena cava syndrome. In superior vena cava syndrome, what happens? Look at the superior vena cava. There is obstruction of the superior vena cava that impairs the blood drainage from the head. This thrombus causing obstruction, and that's why there is not possible for the drainage from drainage of blood from the head through this superior vena cava, and we know that the superior vena cava opens into the right atrium, and if there is obstruction, it will cause superior vena cava syndrome. Look at the patient. There is facial plethora. You can see the blanching. In here, the facial plethora. And second picture, we have put a stent over here, and that's why the obstruction is relieved, and the superior vena cava obstruction is obliterated by putting that stent. And in superior vena cava syndrome, it may present with JVD distension. Commonly it may present with papilloedema. On physical exam, you may get papilloedema. This is most commonly caused by the mediastinal mass or the pancreas tumor or indwelling catheter, thrombosis from the indwelling catheter. It's a medical emergency. And it can, as the blood from the head region is not draining via the superior vena cava, so there is possibility of developing intracranial pressure, and there is increased risk of aneurysm or rupture of the intracranial arteries. That's why the superior vena cava syndrome, you have to diagnose, and you have to tackle this problem cautiously, because it's a medical emergency. This is another CT scan of the superior vena cava syndrome. This is heart. This is a left ventricle. This is aorta, left ventricle. This is the clot or thrombus. This is the clot or thrombus. This is superior vena cava. This is right atrium. Okay. There is a lesion in here, in the apex of the lung. You can easily say that aged person with the apex of the lung lesion, you can easily interpret that this patient might have Pancoast tumor. In Pancoast tumor, also known as superior sulcus tumor, it mostly happens in the apex of the lung. It usually invades some structure. If it invades the recurrent laryngeal nerve, it may cause hoarseness. In here, it is invading recurrent laryngeal nerve. That's why there is hoarseness. It may cause Horner syndrome. Horner syndrome by compressing on stellate ganglion. If it compresses the stellate ganglion, it may cause Horner syndrome, and in Horner syndrome you will get this ptosis, enophthalmos, and hydrosis and meiosis. Ptosis, enophthalmos, and hydrosis and meiosis. In this baby has both ptosis and meiosis. If you examine, there is so there may be supravenacular syndrome, there may be brachiocephalic vein compression and causing brachiocephalic syndrome, unilateral brachiocephalic syndrome, and it can compress brachial plexus due to pancreas tumor. It may compress brachial plexus and causing sensory motor sensory motor deficits. It can cause sensory motor deficit. The other complication of lung cancer, this is the picture, and in this picture you can easily interpret that this is effusion, this is pleural effusion. And the next picture, the lung marking is present, so it is not pleural effusion, it is pericardial effusion. This is pericardial effusion. In complication of lung cancer, you may get pleural effusion, you may get pericardial effusion. This is another picture where there is pericardial effusion. There is pericardial effusion, and you can remember all the complications of lung by sphere. That means supravenacular syndrome, pancreas tumor, Horner syndrome. There are some endocrine paraneoplastic syndrome. There is recurrent laryngeal nerve compression which is causing hoarseness, and there is effusion, pleural and pericardial effusion. Inshallah, if you go through this lecture, you can easily remember all the histology, all the paraneoplastic syndrome of the lung cancer, and it will be very helpful for you. Inshallah.